So all the participants that come are multiple DWI offenders. They are individuals that have been arrested at least twice or more that are now looking for a way to seek out treatment for themselves. They really need to find a way to make a change. So those that are willing to do this, they really take on a lot of encouragement from me, and they really do well with a lot of what they're here for. So we start out with what's called an assessment. I use what's called the Addiction Severity Index. It's one of the evidence-based practices that we have here. We developed it to form our client population. So it's used as a template, but we have developed more in a way where it suits this population for their needs. So there's different parts of this assessment that is just specific to this work that we do. Cultural, identifying tribes, looking at what connections they might have with their tribes, their languages. Things like that are so important because when they come here, many of them are lost and they don't know their way. And if they find someone that is native, perhaps, many of them find that that's a better chance at what they're trying to do for themselves. And the connection is really more significant. The Addiction Severity Index is evidence-based. It is something that we've used and formed to suit our needs here at Evolution, specific to this population. Some of the assessment questions specific to the Native American population are about their languages. Are they connected to traditions and cultures? Do they participate? And these are so important to find so that we know what type of experiences these Native Americans come from. Because what I've learned is some are urban Native Americans, which is someone that's born here and never went to the reservation. And there's some that are from the reservation that are transitioning into the urban area for employment, for other various reasons. And those are some of the things that we look at as far as the assessment's concerned so that we formulate the best treatment we can in that part of their needs as well.
The diagnostic ceremony, what it is, it's basically identifying and using a person's personal narrative and their story. And when I say person-centered approach, it's like we're able to engage with them, building rapport, but also hearing the client's story. So using a traditional method where we basically begin the process of identifying based on their client's symptoms. What we were able to do is allow the client to, again, tell their story, but also to begin the process of engagement. So using what we call protective or supportive factors. So there are these protective and supportive factors that have influence in a person's health. So for example, grief and depression can be associated with sort of a protective factor, you know, a traditional diagnosis. A traditional Navajo term would be hachonje. So we're able to define that or even empower the client to actually begin to see that and identify what, but to also define and look at the symptom in a different way. I like to call this program more of a higher level of care, because the ceremonial engagement, like back home, it would be done, but how does a person sustain, or how does a person continue to maintain wellness and health? So we've integrated sort of, again, these step processes, engaging them in ceremony, rapport, consultations, and then when we begin to engage them in one-on-one and group, and that's looking at developing healthier life skills, using traditional knowledge, which we call like the root of the ceremony. It's like the teachings and how to maintain and carry that. So that in itself is sort of the higher level of care. I think that's, I can see that's a big missing part of like a bigger culture. And then we begin an engagement here at First Nations. That's where we do a needs assessment, and then also we do identify, we present to the client a cultural informed consent, and where we sort of look at possible cultural opportunities, even key similarities, key differences, you know, what the program services we provide here. So we provide individual one-on-one engagements and ceremony, and then we also provide the Native American or the diagnostic ceremonies. The grant itself is it's called the Native American Specific Therapy and Treatment Services. And then we also provide sweat lodge groups, and then a healthy family and community group here at First Nations. So this is our ceremony room, and this is where we meet with families and individuals. We meet for all the traditional ceremonies that are provided for them. So these services are presented to the participant at that point.
We assess risk by using different assessment tools. So we have, as a court, purchased different screening tools for risk, for alcohol needs, for drug needs, for mental health needs, and so we use those along with conversation. I find that speaking with the participant and finding out what their needs are and what their history looks like and how many arrests do they have, and what did those arrests entail when they were involved with them, that also gives you a good picture of their risk needs.